Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And I'm really excited that we have an amazing guest today. Joining us today is Dr. Corey Hastings with Blue Sage Dental, a dedicated and innovative pediatric dentist who's passionate about transforming patient care. With years of experience and a deep commitment to improving access to quality oral health, Dr. Hastings has become a trusted advocate for both his patients and his community. Dr. Hastings, welcome to the podcast.
Hey, thanks for having me, Doc. I appreciate it. Feel honored to be on here.
Well, I have to say, you did not send over this bio. That was something that my team put together because, frankly, we love working with Blue Sage. We love working with you. And I think you are one of those innovative people and an innovative group in this industry, which everybody says they are, but very few truly are. So appreciate what you're doing for your patients and for dentistry, Frank.
Well, now the secret's out. You made me sound better than I would have made myself sound. So thanks for doing that.
That's the trick right now. I mean, and you can listen back to other podcasts. I'm not as generous with other intros. So I genuinely believe it to be true. And so, today you are, like I said, you have a group of practices that is not by just me, but and my team, but you're recognized as really an innovative group of dental practices. And so, where do you see dentistry going now for the people that are listening? Maybe you have a single practice or multiple practices or thousands of practices. Where do you see that this industry is going, that where you're sort of positioning Blue Sage in front of?
Yeah, great question. So we are a specialty group and we focus primarily on pediatric oral health, but there is some referrals that come out of our patient base as well. So I think that we're lagging and behind our medical colleagues as far as communication. Communication's hard. You see it whether you have a small practice, a medium-sized group practice, or a large DSO. And I think communication for the sake of our patients really needs to improve. And so we're trying to position ourselves to be ready for all of the technologies, whether it's utilizing AI or utilizing platforms like your own for Toothapps, where we can have cross communication, not only within our own offices that benefit the patients, but other offices that we may be referring to so that the patient, again, can get the care that they need.
Yeah, it's a big issue right now.
Big.
It's around 50% of people that are referred from one office to another in dentistry don't go, right? It's kind of mind boggling if you think about it.
Yeah, it's crazy. It's communication's hard, right? And we just aren't doing it well. And again, the fact that these patients aren't getting to where they need in a timely manner, whether it's our fault, which mostly probably is the antiquated system that we have on writing paper, or the parents just not finding value in that. We're dropping the ball somewhere as an industry, and we just got to get better with it.
Where do you think specifically within pediatric practices there are sort of special pain points within pediatric offices?
Oh man, besides the parents, I mean, as far as communication, yeah, I think, we refer a lot to ortho, oral surgery. You know, this system we have where we give a piece of paper to a parent, and I know we're talking referrals, but it's communication, right? The communication system we have now is we give a piece of paper, we say, hey, mom, hey, dad, little Johnny needs to go see this specialist. Please give them a call. After you give them a call, schedule an appointment, they'll hopefully have you fill out something on paper. And then hopefully you put our name on there to communicate. That office can communicate to us and we send something over. It's just, uh, it's administratively taxing. It's hard for the parent to keep track of what needs to be done, even though we understand the system and how it works currently. They don't understand. They think it all communicates together because, again, our medical colleagues, if you go to your primary care and you need to go see a GI specialist, they typically are putting it in their system that GI specialist within the network or even outside of the network can see that referrals that had been placed and see all of the documentation, all of the health history, and it's just creating ideally better outcomes for those patients. We don't have that. I'm sure there's times where, even medical histories get kind of locked into our system, but maybe the parent forgets to relay that to maybe another specialist we've referred to. So I know that's a long answer, but there's just so many broken parts. That's why my answer was so long.
Well, and now I'm embarrassed because we do have a referral platform in Toothapps that you have access to that we probably haven't trained your team on. So right after this, I'll be talking to the team about getting you guys going because we actually have a solution to that problem that you're saying is the biggest problem. So,
Perfect.
uh, so yeah, so we'll get you, we'll get rid of that paper for you very like imminently. Because that that's why I know that 50% of referrals never go because that's a problem that we've been working on. And frankly, we were asked to by some of the FQHC spaces
Mhm.
in that space to work on this problem because in there it has to be tracked in order for people to get paid, right? And so so
Sure.
that is a system that we've actually built out. So we'll just tell you how to use it. So and then you can start using it soon.
Perfect.
Great. So you mentioned AI, and I bring it up just because I was on a panel talking about AI last week. When I go out to Boston next week, I'm on a panel talking about AI. So obviously, people in dentistry are talking about AI, and so I have my own sort of vision of where we're leveraging it within Tooth Apps. I'd love to hear kind of where you think, not today, but where because obviously this is a rapidly growing technology, and I'm not going to hold you to this, but just where do you think things are going when it comes to AI?
Man, my team's not going to love this, but I think it's going to reduce the amount of team we have to hire for those data entry simple tasks as far as gathering information, whether from our patients, communicating that information both to providers as well as to insurance providers, and then documentation. It's just I know where it's at now is very helpful with the diagnostic aspect, but I love that it's eliminating opinions, making it more objective, and also eliminating people because people are hard to hire, right? And so, specifically in my mind, do I know? Do I not know? Yes, but I think administrative tasks that are being done, even phone calls, answering phone calls, right? Like how many have we track our phone call answer rate, and it's pretty horrendous because we just get phone calls all the time. And so again, it's creating a barrier to access to care. But if you have a bunch of computers that are trained to answer questions non-clinically, that would be helpful as far as eliminating barriers and getting patients in an effective time frame.
Yeah, I totally agree. And I think that, the way that I look at it, there's a lot of boring, mundane, laborious tasks that humans don't want to do that AI is actually very good at. Even answering I don't know any dental team member that's, well, what I don't like about my job is I can't talk on the phone more, said no dental
Nobody.
employee ever, right? I mean, so, or boy, I wish I could do more paperwork, right? And so, you're exactly right. There's and dental practices are every dental practice is overwhelmed right now with things that AI can do relatively easily, like you said. I'm really excited about AI doing things that humans can't do, like predicting the probability of a patient showing up for their appointment, and then automating workflows, making sure that they show up for their appointment, stuff like that. Because I think it's very exciting. I know one of the reasons why I want to ask you is that I think it's really exciting where things are going. I think that a statement I'll make that you can either validate or discredit that people either think that AI is here to take over the world and we're doomed, or it's absolutely worthless and nobody's going to want to use this technology. And I think it's probably somewhere between those two pillars, right?
Yeah. Yeah, I mean, we're so polar today and everything, and I think that those disparate thoughts, I think we're somewhere in the middle as well, for
Yeah.
sure.
So what have you seen over the last 12 months that you think, boy, I'm really glad that we at Blue Sage are doing these things
With AI?
just in general.
Just in general, okay. Yeah, I mean, we've really streamlined our KPIs. I mean, we're pulling from a lot of we utilize Toothapps, so that's a plug for you and your organization. We think it's great. But,
Thank you.
historically, we were taking data from various platforms and smashing it into a Google document, hoping it was accurate, and then making decisions based on that, right? But what we found is there was a lot of lag. It wasn't standard. Some people were pulling from one report, some from another. And so your platform's really created a standard central, system for information, right? And so we're pulling from that and we're making our decisions based on that. And we're trying to change behaviors based on that. Hopefully, AI in the future will get trained through that platform as well and those data points. But that's really over the past 12 months where we've leveraged technology the most is just centralizing all of our data. So we know where we're at. We know what we need to change as far as behaviors and creating successful outcomes for our patients.
And it's another thing that we can turn on for you. We have recently launched our workflows based on our metrics. So we can automate workflows and leverage some AI to do the things that you're talking about. If this, is going on, we can flag things and do a whole nother talk show that we can talk about. That your team and my team can get going after this. So I appreciate that. It is a that's we've talked before about
Mhm.
how the problems. I think the biggest problem in dentistry personally is the lack of data accessibility, not just for patients, which is a very big deal, but also for dental professionals to be able to do the best work, right? And so I I appreciate, I think we sort of share that passion about data, which used to be like a nerdy thing, but now it's becoming like a cool thing. Kind of like Marvel. I grew up watching reading Marvel comic books and I was like a gigantic nerd. And now they're the biggest blockbusters out there, right?
Now it's cool. Yeah,
Yeah.
absolutely. You've been holding out on me, is what I found out through this discussion.
Oh, really?
I can't wait
About
for all these features that you've been holding out for me. I'm
well,
glad.
yeah,
I'm excited.
there's a lot coming. I think, and I really have to credit you and your organization for a lot of these bringing together of separate systems, because you're not alone, but I think you're relatively alone in recognizing the need to bring these separate systems together. And so, because we've been talking to many organizations, and really a smaller percentage go, oh, this is going to be powerful, and you guys got that right away put into place, and now I think are sort of reaping the benefits from that. So I think it's really the vision to be able to see what's possible, and some of the things that you guys are tracking are, I mean, I think once other people would see the stuff you're tracking, they go, well, I would want to do that too, right?
Sure, sure. Well, thank you. Appreciate that.
Sure. Well, so any other thoughts? If you're looking forward to, because we're early on in 2025, and you're thinking
Yeah.
December 2025, what what changes other than, I guess, solving your referral system and workflows based on KPIs, which we can do this quarter. Any other things that you're hoping that you could, that dentistry is going to be moving towards for your practices and your patients?
And I know it's coming. I'd love to have AI generated soap notes and exam notes that would get in a clinical format, but also a layman's term format so that a text summary can be sent to a parent. I think, again, it all comes down to communication. I think most of our issues are communication. If there would be a way that it takes what I say and summarizes it in layman's terms for a parent to see, because oftentimes, a nanny's bringing the patient in our world, right? A nanny's bringing the patient, maybe a grandparent, and we're expecting that grandparent or nanny to relay the information to mom or dad. Well, oftentimes I'll get a call 2 or 3 a week that's like, okay, you talked to grandma. Maybe I didn't understand. Can I have that conversation? If we could have that in a summarized text for them to have access to, that would be ideal. I think that would be eliminate a lot of the communication issues, misunderstandings of treatment plans, post-op instruction, clarifications, all of that stuff would be pretty impactful to the patient care and outcomes for us.
That's great thoughts. And I also have to mention that, it's been a few years since I saw patients day to day, but I did see a lot of kids
Yeah.
because I loved treating kids. But when you mentioned the parents, I had a little bit like, that it's like that nightmare of school, the school exam that comes on. Like, that there's like, there's about five different sets of parents that
Oh
flash
yeah.
through my brain quickly, right? And got a little got a little anxiety that I haven't had for several years. So thanks for that, my friend. I
You're
appreciate it.
welcome. You're welcome. I'll direct all their future calls to you.
Well, so if people are listening and they want to know more about Blue Sage, because I think, like I said, you guys are a very innovative, that word's used too much. So maybe forward thinking group that's actually not just thinking about the future, but actually implementing tools and working to progress for your practices and your patients. So if people want to learn more, where should they go?
Man, they can reach out to me directly. I love this profession. I love what we do. I love efficiencies. You can contact me directly. My cell phone's 314-496-3562. If you want to know more about our organization, it's bluesagemanagementgroup.com. And they can find a lot of information there and various other leaders' contact information on that platform.
Well, thank you so much, Dr. Hastings, for being on
Hey,
the podcast. I very much appreciate it.
thanks for having me, buddy.